When you search on Google, you may see many techniques in hair transplantation. In fact, there are just two techniques in hair transplantation. First is FUT, which means follicular unit transplantation. Second is FUE, which means follicular unit extraction. The other techniques you see on Google, such as Sapphire Hair Transplantation or DHI, which means direct hair implantation, or micromotor, etc., are not a hair transplantation technique. They are just a way to one of the 4 steps of hair transplantation, as channel opening or implantation of the hair follicle. Let's review these techniques. Number 1, the first one is mother technique, is FUT technique. And the application of this technique started more than 50 years ago. Basically, in this technique, a hair strip is removed and separated to the follicles under the microscopic view, and then the follicles are implanted to the area of bald skin after the channels are created. The main disadvantages of this technique is linear scarring in the donor side. Number 2, our currently used technique is FUE technique. And the application of the technique has started 30 years ago. Basically, in this technique, hair follicles are harvested by with a micromotor or puncher from the donor area, and then these follicles are implanted to the bald area by using a forceps or implanter pen, which is much better and less traumatic. This technique provides high number grafts, natural results, fast recovery, and minimal scarring. That's why in our clinic we use FUE technique with utilizing the implanter pen and micromotor technology to make it perfect.